Hi everybody and welcome back. I'm Dr. David Curry, and today what I would like to do is describe sciatica. The medical term is called sciatic neuralgia, and we're going to talk and refer to this as sciatica. Now, what is sciatica? Oftentimes sciatica is confused as a pulled muscle in the leg because of the leg pain. The leg pain of sciatica is very distinctly different than a pulled muscle. A pulled muscle would be something that feels more like a cramped, achy, sore feeling, whereas sciatica is going to be a burning, hot poker type of a pain into the leg, and it could end up developing into numbness. Now, a pulled muscle would never be numb. That would not be a pulled muscle. A nerve that's inflamed over the long time eventually develops into numbness. So if you have numbness into your leg, that's the first clue that it's not a pulled muscle. Now let's just take a little closer look at what is sciatica, where do the nerve roots come from, and exactly how does this condition develop along the way. So here's a chart of the nerves, and let's take a closer look at these. And first off, the sciatic nerve starts in the lower back. The main branches start out in the lower back, and it projects down the back of the buttocks, down the back of the thigh, behind the knee, to the back of the calf, all the way down to the heel, and wraps down underneath the foot. Now let's not get confused by what you're seeing on this chart on the left-hand side here. Those are the more superficial nerves, and this is showing the deep nerves here on the right side. The sciatic nerve, where I'm pointing my finger to and traveling along here, is a very thick, deep nerve that runs again down the back of the leg. So typically the person will present initially, and their initial complaint that they'll have is lower back pain. It may be pain that comes and goes, but once they start to have this pain start to project and radiate from the back down to the back of the buttocks into the upper thigh area, that's when you can clearly tell it now has become sciatica. Now that nerve will start to travel further down into the lower thigh, into the behind the knee, and down into the back of the calf, again all the way down, because it's following the course of that nerve as it goes down here. Interestingly enough, most of the time the pain of sciatic neuralgia follows the back of the buttocks, again the back of the leg, but it could be an involvement of a branch that comes out laterally towards the side and the hip area, or more down into the groin or the inner thigh area along into this area, or it could involve a branch that goes down the side, the outer side of the calf area. This again could be sciatica. Now again, typically lower back developing into hip and leg pain, and eventually it could become numbness. Typically it's numbness in the lower half of the leg. Sometimes it could be the whole leg, but most often we'll see it's down in here. Numbness is the condition that really catches a person's attention, and they can't deny it. It's a problem once they start getting numbness. It's a new complaint. We often get pain, but we don't get numbness very often. So that's how that works. Now, when we relieve the pressure here off of the spine, this is the source of the problem. As that pain starts to relieve in the lower back, they'll start to feel pain start to lessen up into the buttocks and the upper thigh area, and then it will start to typically move down in segments as it continues to resolve and heal. So again, this is the presentation of sciatica. That's what the condition is that we call sciatic neuralgia. I'm Dr. David Curry. Thank you for joining us today, and you have a great day.